As a practitioner, I feel it's a great honor and a privilege to take care of people. And I can't imagine doing anything else with my life other than, being a healthcare provider. And I feel very blessed and fortunate that that's how I make my living, is to help people. Hi, my name's Megan Thoms, and I'm a physician assistant at OnPoint Internal Medicine in Highlands Ranch. I grew up in Littleton, Colorado, not too far away from here. Colorado is really all I've known. So I've always worked here locally in Denver, the Denver area. Maintaining a healthy work-life balance, I think, is really critical for everybody. I feel it's really critical for me too. So how I like to achieve a work-life balance for myself is I love being outside. Anything outside is gonna make me smile. I'm gonna be out gardening, or I'm gonna go paddleboarding over at Chatfield, or out on a hike up in the foothills or up in the mountains, climbing a 14er, and skiing, because we're here in Colorado. And that's something I've grown up with and something I've taught all my kids how to ski, and we all ski together as a family, and I'm even a ski instructor. We're an internal medicine office, so we see 18 years and older. So a lot of different decades and men, women, and it's wonderful. I think that's what I really like about primary care is you get that full spectrum of age, and you also get a lot of different elements of that. Sometimes it's acute, but then you're also managing chronic care. And then we have preventative care, so we do all of that as well. We also provide women's health care, and a big piece of women's health also falls into hormone health. So starting at 30, going forward, definitely 50, peri-menopause, menopause starts to creep into the picture. And that creates a lot of symptoms for women. So that's where hormone health and a bigger discussion around hormones and what they can provide for women and men as well. So it crosses over into that too. So when patients come to see me, what they can expect is me walking in the exam room. Unfortunately with masks, you don't get to see me smiling, but hopefully you'll see my smiling eyes. And I hope to put people at ease and try to create that rapport with them. And hopefully they feel like they have a friend, that they're just talking with and they feel comfortable with. Preventative care has come to the forefront of what I like to do. So generally when people come in to talk to me, we're gonna have probably a discussion around holistic nutrition and how you really should try to eat to support what your body needs, and how you need to move and what type of exercise to do. When I have conversations with patients around lifestyle changes and holistic nutrition and what they can do to help reverse a disease state, those are things I love to do, because people have the power to undo things. Just because they have a family history, genetic predisposition, that doesn't mean that has to be what is going to happen to them. And I love the opportunity to sit down with them and talk around what they can do and empower them to be able to make these changes so it doesn't go on to become a disease. I think something that I always bring to the table as a PA is that I've become a really good listener. And that's something that I've really just picked up through the years. I feel like if you listen long enough, and of course asking some questions along the way, patients will usually tell you what's going on. I think that drive to continually want to help people is what keeps me going. And I definitely see it as a privilege and an honor to take care of people and for people to trust me with that journey.